स्टार्ट कर रहा हूँ हो गया ना. Hello students, good evening. Hi Aman, Anushka is there, Pooja, Aparajita. Hello, good evening everyone. We had a small technical glitch. That's why this delay. I'm really sorry. Uh, Hope we are good to go. Good start. Okay. So in this session, I'll be discussing almost all the surgery PYQs from INI-CET. Okay, from May 2025 to last 5-6 years. There are so many repeats are there. Okay, so and many only a few questions from surgery they ask, and very simple ones, straightforward ones. No one or two difficult questions so far in INI-CET from surgery. We will discuss everything. Okay. I am fine, Shankar. How are you? Swati, good evening. Tota Gota is there. Very good. Aishi, good evening, everyone. Okay, we'll start. I'll show you the questions. You first answer, then I'll tell you the right answers. Okay. Let's see how much. What's your preparation levels? So first question about type of knot. We have discussed this in the class. So surgeon knot is described as, what is the composition of surgeon's knot? Okay, so single throw in one direction and two throws in opposite direction, or single throw in one direction followed by one throw in the single direction, or double throw is in one direction followed by two throws in opposite direction, or the fourth option is double throw in one direction followed by single throw in opposite direction. What is the right answer? HS is answering D, Sada is also D, Pooja is D, all my students answering D. So with that confidence, I also mark it as D. Let's see what's the right answer. Okay, so for everyone answered as D. Gokul, even I wish I could see you. Okay, someday. Soon you get the good INI-CET rank, and let's meet together. Okay, Gokul. So everyone telling answer D. So here is the answer. The right answer is also D. So we have discussed this in class. The surgeon, there are so many types of knot. Okay, simple knot, granny's knot, square knot, everything. But the most commonly used one or asked in the exam is the surgeon's knot. In surgeon's knot, first we take two forward loops and put a knot, then one reverse loop and put a knot. Okay, only one simple knot, that is a simple knot. One like this, okay, another like this, that is become granny's knot, very weak knot. Okay, granny's knot, single in the same direction, single, then reverse one single. Okay, that is squaring, proper squaring. Once like this, once like this, that becomes a square knot or reef knot. Two in forward direction and one in reverse direction, 2 1, that becomes a surgeon's knot. Hope this is clear. Okay, one questions will be there from this. So many questions from whatever research I have done from the previous year questions, most of the questions are related to sutures, suture materials, knot. Okay, very less from other general surgery topics. So be thorough with one this topic of suture materials, sutures. Okay, so that's the answer, correct answer. Second question. This question many times repeated, many a times it's repeated. Which of these is a non-resorbable suture, also called non-absorbable suture, among the following? Okay, the options are polyglactin, polypropylene, polydiaxanon, or catgut. Which is the right answer? You please tell. What's the answer? Sada is telling A. Okay. A. Aparajita is telling B. Very good. Any other answers? Very important. We have discussed this in class. Okay. So the right answer is Poly, yes, Komal is right, Ayush is right, Manasi is right, everyone are right. Good. The answer here is polypropylene. Polyglactin is nothing but Vicryl. Okay, this is Vicryl. Vicryl is absorbable. है ना. Polypropylene is proline, that is non-absorbable. Polydioxanone is PDS. PDS is also delayed absorbable. Catgut तो एक ही सप्ताह में, within 1 week it gets absorbed. Okay, so answer here is B, that is polypropylene. This again, this classification we have discussed. I have given this chart in the class also, in the notes it's there, very much there. You can go through and revise. They can be, suture materials can be broadly classified into absorbable and non-absorbable. Okay, so again, depending on their source, it can be further classified into natural or synthetic, right? So if they ask you which are all the naturally available absorbable sutures, then catgut is the best option. If they ask synthetically prepared absorbable sutures, then polyglyconate, polyglycaparon, polyglactin, that is nothing but the Vicryl, or polydioxanone, also called PDS. Okay, so these are the ones commonly used. If they ask naturally available non-absorbable or non-resorbable, both means the same, then we have best example silk, linen, nylon, cotton, etc. Whereas synthetic, most commonly in our surgeries we use these group of sutures, that is polyester, okay, or polyamide, okay, or polypropylene, these three. Hope this is clear. Okay, another classification that is monofilament and polyfilament. Okay, in these set of sutures, can you give an example for monofilament suture? Monofilament, can you give an example from these non-absorbable ones? Give an example for monofilament and one example for polyfilament or multifilament, both the same. Give an example. Monofilament, non-absorbable. Multifilament, non-absorbable. Let's see your understanding. Please be active in the chat sections. Please keep commenting the answers. So if they ask you which is the monofilament among these non-absorbable ones, you have nylon is there, okay, then all this polypropylene is there. These are the monofilament one. Whereas multifilament, this polyglactin is there, okay, silk, nylon, monofilament, very good. Polypropylene is monofilament, very good. Silk is multifilament. Silk, linen, cotton is multifilament ones. Okay, so that's another classification we should know. There are so many other questions on sutures and suture materials. We'll discuss it further. One more simple yet important question they have asked in INI-CET, that is what is the advantage of chromic catgut over the plain catgut? You know what is catgut, why it is used and all. Okay, so there are two types of catgut, from where it's obtained, everything you know. So what is the advantage of chromic catgut they are asking? Can you please tell? Is it helps in delayed absorption, or it has got less tissue reaction, or it has got more strength? Why they are asking you why the chromic layer, chromium layer is given? I have discussed this in the class again. The problem with the catgut is it gets resolved in 1 week. So I want to make it more, little more. It stays for little more longer. Okay. So for delay, okay, all of you are right. All are answering as A. So the answer must be A only. To stay for little longer, for say 2 to 3 weeks, I'll give a coating of chromium salts over the plain catgut. So that's for delayed absorption. Okay. Other things also right. You are right. But the best answer is delayed absorption. More strength, okay. Less tissue reaction, okay, great. But the best answer is delayed absorption. Hope it's clear. Okay. Next question. Which of the which of these would point directly towards ectopic thyroid instead of metastatic thyroid carcinoma? So which point or which distinguishing point you can see in these options to tell you this is ectopic thyroid, not metastatic thyroid? There are two types. No, thyroid can metastasize to anywhere and form a nodule, or the thyroid itself can present in some other thyroid tissue can present anywhere. Okay, other than the normal position. Then it's called ectopic thyroid. Anywhere along the line from the what is it, foramen cecum till the thyroid not the cartilage. It can along the diverticulum. It can present anywhere the tissue. So it is called ectopic thyroid. Okay. So how do you distinguish thyroglobulin and TTF? It should be TTF. Okay. TTF1 positivity on fine needle aspiration biopsy. Hyperemic midline mass at the base of tongue in an young female. Uncapsulated thyroid follicles on histopathological examination. History of thyroidectomy in a patient with midline swelling at the base of the tongue. All of you are answering very quick answers there. Although this is a difficult question, I should agree that. But all of you are answering as B. So let's see what is B. So hyperemic midline mass at the base of the tongue in the young female. Even I feel the same. But let's rule out one by one other options and then come to a conclusion. Okay. Thyroglobulin TTF positivity on FNAC. It's more for malignancies. Okay. Thyroglobulin, we mainly do it for screening purpose after surgeries or treatment for thyroid malignancy. So this is not the option. Unencapsulated. Okay, means capsule is almost breached. Thyroid follicles on histopathological examination. Thyroid follicles is coming out of the capsule. That means some invasion into the capsule is present. So only it should be malignancy only. It can't be possible in normal ectopic thyroid. Correct? So this is feature of papillary thyroid cancer. Papillary thyroid CA. So this also ruled out. History of thyroidectomy in a patient with midline swelling at the base of the tongue. Why anybody will do surgery for a normal thyroid tissue, right? So it must be a malignancy only. That's why they have removed. Okay, so this is also ruled out. It's a more in favor of malignancy. So any in the young females coming with the swelling hyperemic because of thyroid tissue, has got high vascular supply. So hyperemic means increased blood supply, midline mass at the base of the tongue is more suggestive of ectopic thyroid gland, not malignancy. Okay, so answer is B. Hope it's clear. Next. Yes, this I have stressed a lot in the class also. There will be definitely be one question from this chart, whatever we seen or discussed in the class. It's IV cannula sizes. Okay, different sizes. What's the flow rate? They can ask you. In INI-CET, relatively tough questions will be asked. Whereas in NEET your entrance exams, they'll ask you what's the size, what's the color of this cannula and all. Okay, simple questions. So now please tell me, 20 gauge cannula, IV cannula, what is the fluid rate? I had requested you to go through that chart. Okay, Aparajita is telling B. Okay, good. Any other answers? Okay, A, B. Which color at least tell me? 20 gauge IV cannula means which color? What's the color of the cannula, 20 gauge cannula? Yes, correct, Abdullah. He remembers the class very well. I had shown this with a flower diagram, how to remember. From the ground it's brown, then correct? Very good, Pooja. Very good, Aparajita. Excellent. Excellent. Okay. So 20 gauge we are talking about. It is, see here, 20 gauge. Okay, it's pink in color. So almost 60 ml per minute. Okay, so 50 to 60 we have this in the option. Okay, so answer B is the right answer. Answer B is the right option. So at least please know this one chart. Okay, very high yielding, very high yielding chart. So many questions in all the exams. So I can't make you understand something. There is nothing to understand here. You have to just mug up and remember things. Okay, what is the which gauge, which color, at least which what is the flow rate? That much you should know. If not the diameter and all. Okay, our favorite topic, and all my students are well versed with this topic. Whatever question comes, they'll definitely answer. That is trauma. A in A B C D E of trauma stands for. What is A stands for? They're asking. The level of preparations you are having, these kind of questions will be very simple, but don't neglect or don't consider them as silly. There will be some twist, so look carefully and then answer. Don't get confused. If there are some simple questions, there will be definitely some twists will be there. So look carefully or think twice before answering. Okay. Very good. All are right. All are great. Okay. The important thing is there is A for not just airway, but along with that there is another component equally important, that is protection of the cervical spine movement. Okay. So Abdullah, that's the thing there. It's not just airway. Airway with C-spine control is the, okay, that's the thing. That's the trick or twist there. Okay, so answer C is the better answer, not B. Okay, although A is also answer, B also answer, C also answer, but best answer is C. Hope it's clear. Next, which of these sutures attract bacteria and cause wicking of soft tissue due to absorption of fluids? Where there is a scope for enlargement of bacteria, that's all they are asking. Simple. If you understand the concept I just discussed in the first question, then you can answer this. Yes, you are all right. Why? Tell me. This question is very simple, but tell me why. What's the difference between A, C, D and B? All are telling B as answer. That's correct. Silk is the right answer. What's the difference? Why B? Why not A or C or D? That is, B is, silk is, just we discussed, that is a multi-filament or braided suture, means multiple filaments are fused together like this. So in between the threads there will be gap where bacteria can be lodged, whereas in monofilament there is no, it's a very smooth surface, so bacteria can't be present there, it will fall off. Correct? So that's the main difference. So answer is B. You're all right. Good. Okay, this is a bit difficult, not for you actually, should not have asked, even for any medical student or any, for me also it's a difficult question, and it's no mention of this kind of things in any books or so. It is a very applied one. So consider the option. 4 malignancies they have given: carcinoma of kidney, lungs, liver and breast, and they have asked, okay, for a dental surgeon, which may be the, from where it can metastasize commonly to the tongue, they have asked. They may come with a metastatic nodule in the tongue. From where could be the primary? It's important to know, because accordingly you will get the imaging or any other investigations done. So what are the possibilities, high possibilities of tumors metastasizing to tongue? From which place? From kidney, lungs, liver or breast? Which 2 options? I don't think anyone can know this answer, but still, then what is the best option is to rule out the options and come to a conclusion. Kidney, from kidney it's a retroperitoneal organ, can it come to tongue? Unlikely, that's ruled out. So the options which all have got 1 is ruled out. Option A is not possible, D also not possible. Then you can go for this. See, like that, if you can rule out 2 options, then between another 2 options you can take a chance. The chance of you becoming right is 50%. If you can't rule out anything, okay, A or B or C or D, if you're confused among all 4, then don't go for it. the chance of you becoming right is only 25%. Okay, so now I have already ruled out two options, so B and C. So option 4 is there in both, so carcinoma breast is one option, correct, it must be correct. Between 2 and 3, from lungs or liver, from where, lungs or liver, you are all answering as B, so then I'll also go with that only, must, because you are well read and you much more than me, so I'll also go with your option only. Lungs is very near to the tongue, so that could be the answer. Let's see, let's hope for the best. Okay, all the best. And the answer is that only. Answer is lungs and the breast. It's very hematogenously, it can spread to the tongue. Okay, don't ask me how, why and all, no answer. Okay, it's a observation retrospectively observed. Okay, next question. Match the effect of pressure on the underlying structures with the effects that will be seen in the thyroid. Okay, thyroid means, so big goiter is there. Okay, goiter is there, so it is compressing on the underlying structures. So which structure will cause what symptom? If it compresses on the trachea, what is the symptom? If it concentrates on the esophagus, what is the symptom? That's what they are asking. Okay, so please, trachea, hoarseness, Horner's, dyspnea, it's not dyspnea or dysphagia. Which one? I know it's dyspnea, it's one. A. Esophagus will cause dysphagia, right? Dysphagia. Recurrent laryngeal nerve will cause hoarseness of voice, just like mine. See, I'm having very bad sore throat since 2-3 days, but I could not cancel today's class, so I'm just doing with a hoarse voice. This is called hoarseness of voice. Okay, very hoarse, coarse, crude voice. Hope it's bearable. The cervical plexus, any sympathetic plexus can lead to Horner syndrome. So this is the, so A for A3, B4, C1 and D2. So A is the right answer. Okay, that's how you. Okay. Frequency of this is again we have discussed in the class. Electrosurgery device used in surgeries, frequency they have asked. What is the frequency? Okay, you know, bipolar cautery, unipolar cautery and all we have discussed. What is the frequency? Which, how many hertz? If you don't remember, it is 100 kilohertz to 5 megahertz. Okay, you remember this thing we have discussed. See, this exactly in the notes in the class we have discussed this. What is the difference between monopolar and bipolar cautery? Everything we have discussed. That time I told. Okay, it is a work. It's an alternate current of how much? 100 kilohertz to up to 5 megahertz of current is used for different, like cutting, coagulating, different purposes in case of a electrocautery unit, surgery device or electrocautery unit, both the same. Okay, hope it's clear. This is like, I would say, moderate level question, this one, and because everyone can't know or remember this tongue one, I would say difficult one. This one consider option, and it a very easy question. What is the thyroid one? Okay, this is moderate, and let's see. Okay, here is a twist. Okay, one different thing they have asked in INI-CET but never asked in NEET PG. Okay, so what would be the TNM classification of skin melanoma they have asked. Usually they, for you MDS entrance exam, they ask only of overall malignancy TNM classification. Here they have asked about one very special skin malignancy, that is melanoma. In that there is a grading system is a bit different. So TNM staging they have asked, unfortunately. So this thing, one extra thing you should study and go for this time, because it may repeat. We don't know, because in INI-CET from surgery so many question repeats are there. So you should know the answer for everything, every PYQs, and also the related concept. This time they have asked surgeons knot, next time they may ask granny's knot. So you should know in and around that. This time I asked non-absorbable suture, next time they can ask absorbable sutures, like that. Okay. So TNM's depth 2.1 to 4 mm they have asked. Okay, next time they can ask something else. So 2.1 to 4 mm is T3. T3 is C. C is the answer, like that. Okay. Anybody answering? Thank you, Raya. Thank you so much. Who is that? Ride with SAP, it seems. Good. Okay, T1. Okay. You already know this. Very good. Very good. TNM classification of melanoma you already studied. Very good. I didn't expect. This is difficult, I would say. Next, this is our most favorite and we are well versed in this. That is Glasgow Coma Scale. Anything you ask, we are ready to answer. We don't even require options for these kind of questions on trauma, on Glasgow Coma Scale, burns. Okay, just like ride with SAP told, even if you are sleeping, we are ready to answer. Okay, so the M3 means what? Motor. M3 is very good, very good, very good. See, all are right, very good. M2 is what? M2 is flexion or extension? M2. Okay, this is correct. M3 is decorticate, correct? Decorticate is flexion, okay? Whereas M2 is decerebrate, that is extension. Very good, right? Right with SAP is fully, I don't know who's that girl, or mostly girl only. She has extensively revised and fully prepared. Abnormal extension. Very good, my dear. Very good. Very good. Okay. So we'll again, another question is there. We'll discuss that time in detail about the GCS. One more question. Very simple one. Common sense can answer here or prevail here. Common sense can prevail in this kind of questions. Patient having a facial wound, lacerated facial wound. Which treatment modality is not used? They are asking. Not used. Don't get confused here. See, those things you usually get wrong. You don't read the question in a hurry. You miss this small word not. Patient lacerated wound, which treatment is used? You just read like that, then you answered something wrong. Okay, so not used. Okay, so adhesive paper strips we use. Okay, and tissue glues nowadays for face and all we use. Pins we don't use. Pins don't use. Suturing is the best. This is the best. Very superficial wounds, only for superficial wounds. This can be used. Staple pins you can do, but leaves very ugly. That's why they clearly mentioned face. It will leave a very ugly wound scar. That's why it is not used. Staple pins. It can be used anywhere else in the body. Okay, so you're all right. Okay, answer is staple pin, which is not used. Okay, next. Okay, identify the instrument. They have asked. See, that's the beauty about what I like the most about INI-CET. They always give a question, applied questions. Okay, not straightforward. They don't ask which instrument is this. Just showing the instrument. They would have shown the usage of it or application of it. Then they ask you what is the instrument or something like that. Wonderful thing about the INI-CET. Those who really read, those who really use their brains, or those who really work during an internship can answer these kind of questions. So they say polytrauma patient, okay, head injury. There's many things. See, cervical Philadelphia collar has been put there. Can you see there? Can you appreciate Philadelphia collar? Full facial fractures must be there. Everything is swollen. Raccoon's eye sign is there. What it's suggestive of, you know now. Raccoon's eye sign, and this must be bleeding. That's why they put some instrument inside the nose. They have put and packed to stop the bleeding. What is that? What instrument? All of you are right. It's Foley's catheter. It has got a balloon inside, no? So you put the Foley's catheter inside the nose and inflate the balloon. That will act as a tamponade effect, pressure effect. Okay, to stop the bleeding. Very good, very good. So, see, this time they ask Foley's. Next time they can ask another tube, Riles tube. So be prepared like that. I'm just giving an orientation. I'm not spoon feeding you. See, this is the question. Next time you prepare for like that. No. These are the possible questions. These are the questions asked. So be prepared for the possible questions in and around these topics. These kind of topics. That's what we are telling here. All the following are incorrect about GCS except following are incorrect except means which is the true thing. So understand like that. First read the question and try to analyze the question and come to conclusion. All of the following are incorrect, okay, except means which is the true among the four they are asking. So GCS scale measures need for urgent surgery. No, that's not main the objective, okay, that's incorrect. Used for detecting level of consciousness and response of patient to stimulus. Yes, I feel so, yes. GCS 5 means a conscious patient. No. Less than 8 is unconscious. Has little role in management of acute trauma patient. Not at all. In acute cases only we use GCS, which helps us highly in managing the cases. That's how we conclude. So answer is, sir, please scroll off melanoma staging. There's nothing much to discuss, Sahin, in that. You can read. It's available in your books or notes. You can just go through that. Okay. I'll be sharing this PDF also anyway. Answer is B. This is the Glasgow scale for your reference. You know this very well. Still, again, you have to, if I put something means it's most important, very high yielding and most probable question. So you have to know this very well. See, already in last 5 years, two times this topic has been repeated. So that means it's very important. Okay, very simple, straightforward, common sense related question. Quickest way to control bleeding in an emergency is, okay, road traffic accident, someone is bleeding, okay, what is the quickest way to stop the bleeding? Pressure, ligation of the bleeding artery, cauterization, or you go to the shop, bring a laser machine and then stop the bleeding. See, it's a simple, I don't know, maybe their intention is to reinforce in your mind the concept, maybe, okay, not just checking your knowledge. Very good, all of you are right. Take any cloth or anything available in and out there, so put up pressure over that area. It will stop, most of the bleeding will stop just with pressure. Okay, next question. Yeah, on fluids, this also we have again discussed multiple times in the class. There are two types of fluids, in fact three, crystalloids, colloids and blood products, right? So mainly difference between crystalloids and colloids you should know. The small particles which can freely move from intravascular compartment to the cells and come back, then it's crystalloids, which cannot move, larger particles which cannot move out of the vascular compartment, it's called with high molecular weight, then they're called colloids. So which of them is the colloid they're asking? Starch, which is the fluid derived from the plant source, DNS, ringer lactate and half normal saline. You may get confused with half normal saline. It's not a colloid, but it's a hypotonic crystalloid. That's a confusing point. So answer is, like you all mentioned, it is A. A is the answer. Why someone telling C here? Ringer lactate is definitely a crystalloid. It's number one crystalloid. DNS is a crystalloid. Normal saline is a crystalloid. Starch is a starch. Albumin, all these are colloids. Okay. Dextran. No confusion in such things. Simple. Again, I've given this chart for you. Please read at your own leisure time. Crystalloids, isotonic. It could be isotonic, hypertonic, or hypotonic. If it is the osmolality is between 240 to 340, then we call isotonic. Means in par with the plasma. If it is more than that, hypertonic. More than 340 is hypertonic. Less than 240 is hypotonic. Okay, we should know this. Very important. So all the fluid examples also you should know. Small changes are just note here. Okay, 5% dextrose in water. Okay, it's a isotonic, whereas 5% dextrose in saline is hypertonic. See, subtle changes makes a lot of difference. If you read half superficially, you will get confused. So 5% dextrose in water makes it isotonic, whereas 5% dextrose in half normal saline makes it hypertonic. Okay, so half normal saline is isotonic. See, normal saline, that is 0.9% saline is isotonic, whereas 0.45% saline is hypotonic. So these are the things, you know this already, but you're not may not be giving much attention to these. That's why making silly mistakes. That's it. So please revise again and know this concept very well. Important. Okay, colloids like albumin, pp, plasma protein fractions, dextran, starch, all these are best examples for uh, this thing, colloids. Okay, next, again the same question was repeated. 0.45% NaCl is what kind of fluid? It's example for what? 5% dextrose is, you can with water only you can consider ikigai. Okay, if it's not mentioned, just 5% dextrose, then you can consider it as isotonic. 5% dextrose with half NS, then only it is hypertonic. Okay, correct. Hypertonic is the right answer. Just we discussed. Good. Gagan, very good. Lavanya, excellent. Shweta is also there. Very good. Varsha, Rohit, all are right. Good. So another simple question. I don't know why they ask this kind of questions in such a competitive exam. Vicryl 30 is what kind of suture? Non-resorbable synthetic, non-resorbable natural, resorbable synthetic, resorbable natural. Please tell me. Polyglactin or Vicryl. They should not be giving like this the brand names. They should have been given the generic names or content name. I don't know why. Very good. Very good. All are right. How many days can you tell me? How many days it will get absorbed? You are right. It's a C. It's synthetic, correct. It's resorbable also, correct. How many days? In how many days it will get absorbed? I've told this. Vicryl how many days? So catgut how many days? For example, catgut how many days? Vicryl how many days? PDS how many days? And how they get? That's also. How they get degraded also important. Enzymatic this thing or protein denaturation. How? Just tell how many days. Very good. Very good. I want to know who is this ride with SAP. Excellent. Definitely within some 100 rank is session. Confirmed this time. 60 to 90. Very good, Swati. Very good. Go 7 to 10 days. Okay. 60 to 90 days. Very good. This is almost 180 days. Okay, 180 days. Plain catgut we are talking about. Ride with SAP. Okay. Hydrolysis. Very good. Correct. Okay, good. No. Ikigai, I don't know why in Pulse there are so many mistakes are there. Okay, I don't know. Dextrose is definitely a crystalloid. It's not a colloid. Okay. Answer should be some print mistakes, so many errors. Okay. Please, you know the concept properly. You not get confused by the answers given there. Okay. It is answer is extra starch on HES. It's a colloid, definitely. Which of this is a resorbable suture? Again, this question was multiple time it was asked, so I had to take at least twice. Okay, so which of the following resorbable, absorbable? Yes, yes, yes. Gokul is correct. Sada, Shweta, all are right. Good. Polyamide, polyester, polypropylene. All these are non-absorbable. Monofilm, polyglyconate, which is a maxon. It is delayed absorbable. It's absorbable. Okay. I just showed you the this thing. See. You should know both the brand names and the constituents, okay? Or else sometimes they give Maxon, Daxon, Dacron, and all. It should not be given ideally, but if they give, we can't help it. We should know, okay? Commonly used brands. Polyglycolic is Dexon, okay? Daxon, so it's absorbable. Vicryl is polyglactin, it's absorbable. PDS, polydaxonon, polyglyconate is Maxon. All these are absorbable. Whereas polyamide, which is also known as nylon, ethylon, which is the most commonly used for skin, ethylon. Polyester is Dacron, polypropylene is Prolene, okay, and one more is synthetic steel. Okay, this I had put a bet on. This topic I had put a bet with you. One question will be definitely there from this topic. This exam also, upcoming exam also, there will be one question from this. I'll bet. That is the hypovolemic shock classification. Class 1, class 2, class 3, class 4. There are so many features. That box you remember we discussing so many times. So this time also they had asked question. So what is type 2 hypovolemic shock? How much blood loss? Less than 15, 15 to 30, 30 to 40, more than 40. Common question. Even if they ask symptoms, whatever they ask, you can answer because you know this in and out. This one chart, right? So all see, all are unanimously answering one. That is B. Correct. Very good. Good. Very good. See this one chart you should know. Okay. All where the hypertension starts, where there is oliguria starting, where there is a confusion starting, all the features you should know. This one chart, no excuse for anyone. 200% guaranteed question from this. Next, shock we have discussed in detail. Mainly about two types of shock I had discussed. One is hypovolemic shock, another is septic shock in detail because they are mainly related to surgery. Rest all mainly in medicine they ask. So which type of shock is characterized by increase in cardiac output? In all the types of shock there is decreased cardiac output. Okay, in one type of shock there is increased cardiac output. There is increased heart rate in every this thing. But only one thing is decreased systemic vascular resistance happens in something because of the toxins released and all. Nitrous oxide is released, so that will cause us vascular resistance decreased, so the flow becomes more, increased venous return causing increased heart rate and output. Very good. That is septic shock, okay, also called warm shock. The initial phases only, in the later on it also becomes the cold shock, okay, like any other shocks. I think we are done. Okay, one more question. Pinpoint pupils seen in all the conditions except in head trauma. Is an applied question, applied knowledge. Bit difficult, but you can from your pharmacology knowledge, this knowledge, that knowledge, you can just apply and answer here. Horner syndrome we know already. What are the features of Horner syndrome? I also discussed during thyroid discussion, and many others would have discussed this topic. Meiosis, constriction of pupils, and anhidrosis, apparent exophthalmos, all those things. So this is ruled out. Loss of sympathetic tone. Sympathetic means, see, mydriasis. Eyes will be wide open. That is sympathetic. Loss of sympathetic tone means it will cause eyes to constrict. So this is also ruled out. Drug overdose. Some drugs also can cause pinpoint pupils. Like best example is opioids, right? So this also ruled out. So suddenly, ultimately, even if you know or don't know, you will come to a conclusion or to the right answer. Because since you have ruled out all three with confidence, the answer must be, you know it or not, answer should be A only. That's the beauty of the MCQs. Okay, in herniation of the midbrain, because of the oculomotor nerve is compressed, it again that parasympathetic activity is distinct, so that it cause mydriasis. Okay, mydriasis or dilatation of the pupils. Not so that's it. 1 2 questions difficult one that you can definitely somehow you can manage your answer, or rest of the all the surgery questions are seems to be easy because I don't say you're taught like that, but I don't take all the credits. But definitely you have loved the subject, you have read well, you have revised, you have solved so many MCQs during the class and after the class. That's what makes surgery is simple and more than simple. It's a scoring subject for you, scoring subject, and your confidence lies in surgery. Your confidence because you are sure that you can answer any kind of surgery related questions now. Okay. Yes, Sada, ETC auto monitoring is important. So many questions are there. I think anesthesia faculty will discuss about from anesthesia that gases, color coding very very important. Okay, color codings, that which cylinder, oxygen, nitrous, all those things are important. ETC auto is important. Okay. Anesthesia faculty will discuss that. Anyway, thank you so much. Any doubts, please let me know. Put it in the comments section. Okay, I'll try to answer them. You can directly reach out to me also. Okay, my email ID I'll give you. Surgery is taught by Surgeon Kishan. Surgery is taught to you by Surgeon Kishan. Okay, just remember like that. Even in exam hall also, if you don't know something, you can directly through your telepathy just put a mail to me, I'll reply to you. That's my guarantee. In the exam hall you can mail to me from to this telepathy. सर्जरी क्वेश्चन आ गया, सर्जन किशन को मेल करो, आंसर मिल जाएगा. Okay. Anything else? Okay, hope to get many mails during your exams, and hope I'll reach out to you in time and give you all right answers. Okay. Thank you so much once again, my beloved students, and I wish you all the success in upcoming exams. Okay, I am sure in surgery you will never find any difficulty in answering, but I hope so in the same in all other subjects. Overall, it should be a good paper to you. I don't pray for an easy paper for you all. I pray Almighty to give you a tough paper and to give you strength or endurance to bear the difficulty, because you have worked hard, so you deserve for your level questions. Because if the question paper is easy, even those who are not prepared, those not read also, they will use their AK-47 and they'll get right. So then there is no difference between those who read and those who are not prepared. Okay. So I would request for a tough paper, at least so that my students can excel. Okay, because they have really studied well. And you may have self doubts, but I am confident. My intuition says, okay. See, nobody will attend on this 8 o'clock, 9 o'clock class with this much of interest or this thing. Those who are really serious about their preparation, those who really want to excel, those who really want to know about the previous year questions only attend these kind of lectures. Okay, so I'm very sure those who are here are very serious about their preparations, and they are really doing well with the revisions. Okay, they are revising their notes regularly. Okay, so our what is the formula of our success? Hard work, which you already done and doing, but with solving so many MCQs, what you're getting is self confidence. Your self doubting is going out, and self confidence RI. This nobody can stop you. If you do these two, if you have these two, nobody can stop you from getting. Correct, Shweta. Okay. Okay. Okay, then again, what are the time remaining time? Don't waste. Read regularly and daily as much as possible. Read, read, and read. Revise repeatedly. Don't go to study new things now. Okay, just revise whatever you already read. Okay. Thank you, Ikigai. Next, I'm going to read my favorite book, that is Ikigai. Ikigai is one of my favorite books. After exams, you also please read. Wonderful book. Okay, thank you so much. Okay, don't waste your time. Your time is very, very precious, even a minute also. Uh, don't repent later. Don't repent later. Cha, that I should have studied that 5 minutes if I had read more, or 1 mark if I had scored more. I could have got into a better college or with a better branch of my choice. Don't have any kind of regret or repentance later. This is the high time. Okay, do or die situation now. We have to. Okay, I always told you. Okay, more you sweat now, more sweat during practice. Correct. Less you bleed in battle. The real battle is upcoming, so better you sweat more now than bleeding later. Understood? That's it from my side. Okay, anytime related to surgery or anything you want more boosting energy, we are always there. All the faculties are meant for you people. Okay, you have all the right or this thing to ask us anytime. Thank you so much. Let's end the session.